talk about the naturopathic way of treating is to go from least invasive to most invasive. We always want to start with simple therapies. And the reason we want to do that is because we do believe that the body has the capacity to heal itself as long as we give it the right tools and we don't come in its way. And that's something important. I always explain to my patients, it's like if you get a simple paper cut, or a simple cut on your hand, all you need to do is wash it and keep it clean, and the body will heal itself. You don't actually actively do anything to heal that cut, and it will still form a scab. It's the same idea, but with your entire body. If there is something that it's giving you signals if something is off. So if there is bloating, you know that there is something off in your digestive tract, then you need to pay attention and figure out what's going on and give it the tools. And the tools in this case would be optimize your digestion, whether it's with the use of enzymes or herbs that will maximize your enzyme production, and give it the ability to actually correct the problem. More often than not, we see the body is able to self-correct. And we always start with, we don't want to do any more harm. So first of all, look at what you're doing currently that might be contributing to your symptoms and take away anything that might potentially be contributing to symptoms. Investigate underlying cause. We do this as an ongoing process. It's like, okay, maybe it's not the food, or maybe it is the food. So you've eliminated, the notorious foods that cause bloating, but then if you're still getting bloating, we need to figure out if you're not able to digest things properly. Maybe it's not a digestion issue. Maybe you have a parasite, so on and so forth. And then, of course, you want to always design a treatment that's sustainable. So, if it's something that a person needs to do lifelong, it has to be a sustainable lifestyle change. And we often help the patient figure out how they can fit it into their lifestyle. And I always keep telling my patients, we have to treat you as a patient and not just your diagnosis. Your diagnosis might be bloating, but as you've seen, we've talked about it, the reason for the bloating might be very different from one person to another. For one person, it might be enzyme deficiency. For another person, it might be a food sensitivity. So you can't treat both bloating symptoms in the same way. You always have to talk to the patient, find out what is it in their life that's affecting their entire health. At the same time, we want to try and make sure that prevention is a major part of the plan. So you don't want the symptoms coming back. So it's all interconnected. If you identify the underlying cause and correct that, then you should be able to prevent the symptoms from coming back. And try to use, as much. And when we say increasingly invasive therapies, what that means is that we don't always exclude medication. Yes, medications are to be used as and when needed, and they are therefore at our disposal when you need it. But at the same time, that unless your symptoms are so intense that you need medication directly, there are other ways that you can gently support your body. If those don't work, then we want to progressively increase our invasiveness, like in terms of help that you will provide the body, you increase it in intensity. And of course, the long-term goal is patient education and empowerment, which is for the patients to actually be in tune with their body so that they know, oh, when I eat this is what causes bloating. Or when I don't get my sleep, those are the days that my digestion is not proper. These are the things that patients learn over time. And that's what I mean by patient empowerment. So they're able to self-correct a lot of these symptoms on their own, including bloating. They identify the patterns. And this is something we do as a team. When patients come in here, we help them identify patterns. Often patients are so involved in, you're going through your life, you may not be able to see the patterns, but as a doctor, and when they're telling me these things, I'm able to identify those patterns because I've seen them before with other patients. And because I know how things can be interconnected, those are the things I would point out, saying, I've noticed you say that every time you travel for work, when you come back, your stomach is not doing so well. And they say, oh, yes, you're right. Like, I do see that pattern. So it's about kind of putting patients back in tune, like just having them in tune with their body and how it reacts to different foods, different patterns, different lifestyles, travel, even just anxiety, like different stressful situations. Like every time they have a major meeting coming up with their boss, if that's when they feel like their stomach goes haywire or their bloating gets worse, then they know that's a pattern, that stress and anxiety does affect their bloating. So that's kind of where we want our patients to be eventually, where they know what they can do before they have to call the doctor, that they've already identified and it's not a major disease that's causing the issue, that these are the patterns that are causing their bloating, that they can self-correct.